Please do not wait to hear of a death near you for you to realize that the disease is not a joke. By the time you are hearing of a death near you, it could well be your own death. And of course, you won't hear.
A critical curve in the COVID-19 crisis is the worst yet to come. Good evening, the news gang is here, and tonight we take a look at the curve that is getting steeper by the day. Can Kenya keep up with the virus? Also, the recoveries, the glimmer of hope, and the government's dilemma. We'll also look at the taxing times for Kenyans and what the president is seeking to do about it. Is it enough? The curfews, the beatings, and the apology. Are Kenyans living happily ever after? We'll also have the kicker, the memo, the tick, the punchline, and of course, the angle. Let's get this show started. Social distancing, check. Ladies and gentlemen, very dramatic developments today. 29 people confirmed to be COVID-19 positive in the last 24 hours. 3 people dead now, 2 in the last 24 hours. A very significant time, Linus.
Very worrying developments indeed. And Mutahi Kagwe, the CS for Health, has put it correctly there that the message is finally hitting home. Because for those who considered this to be distant news, and there was a time it was distant news. There was a time a lot of Kenyans didn't know where Wuhan is. There was a time a lot of Kenyans could not relate with the Italian story. But today the CS Health, the ministry officials stand up and say, it is getting worse. Not only do we have the highest number of reported or confirmed cases today, but also the highest number of deaths for the first time. 2 is a very, very high number, considering that we had only lost 1 person before. The other thing is, the message is striking home because we are starting to hear names of people who do normal jobs like we do. People with families.
There was a burial in Mombasa today.
Yeah. There was a burial in Mombasa today. Yeah. And this is a pilot of the Kenya Airways. I think it's 8 months to his
10 months,
retirement.
10 months is retirement. Yes.
10 months to retirement. And he did what now becomes the last flight, and he's left us. I think, Joe, today, for those Kenyans who ever doubted that this is serious, the message is home.
Yet, Jamila, you could see the frustration of the CS there. I mean, Kenyans don't seem to be taking this as seriously as they ought to, considering the reality, the stark reality that is now before us.
That is true, Joe. In fact, you could hear the frustration. The minister today in his press conference, and he says that you're waiting to see someone you know having the virus or dying from it for you to believe that this is actually serious. As of today, more than 1 million cases of COVID-19 have been reported in the world.
We've hit the million mark?
Yes, 1 million already. It's 1 million already that has been reported as by this evening. And 51,500 people have died, while about 210,000 have recovered. So we need to start worrying about this, because we need to start taking this seriously. Because remember, I even said last week, if you're going about your life kama kawaida, as you used to before corona virus kicked in and changed everybody's lives, not just in Kenya but across the world, then there's something wrong. You need to be careful, you need to be cautious, because 3 people have died. They are relatives, they have husbands and wives and mothers and sons and daughters. And if you're waiting for it to hit close to home for you to see the seriousness of this, then there's something very wrong.
And I think people haven't made the connection, Yvonne, about how this thing can completely overrun the public health system, the entire health system, quite frankly, because a lot of people are saying, oh, maybe there aren't so many people dying relative to the number of people who are being infected and that sort of thing. But most of the things you read is that about 20% or so of the people who get this thing get seriously ill, so ill as to need medical attention in a health facility. And thinking about how fragile our own health infrastructure is, that is a nightmare if suddenly there are so many people who are so sick, who need doctors. And remember yesterday we had a story where somebody needs cancer treatment now needs to go to India or whatever. That is to say that all the other diseases have not been suspended. People still actually need to go to hospital in critical circumstances and get treated.
And that's exactly what I was, where I was going to begin, that while we are focusing on COVID, because that is big and it's a real serious threat right now, I mean, you're thinking of cancer, that's huge. But there's all of these other things. We've had several cholera outbreaks in the last number of years. There's dysentery, there's all of these things.
The cholera, they say, never really goes away.
Yes, there's TB and a number of these other issues that already have a disease. But in fact, I think just today, the Nairobi hospital issued, a circular where they're closing their satellite clinics. They want to concentrate everything on the main hospital. Obviously, preparing for
But think about the impact of that.
Absolutely.
I mean, they close all of these things. The people who used to use
them and access health there are not able to do that. Those are some of the interesting things. We cannot afford a situation like in Italy where there is a surge on the hospital system. And like you said, ours is fragile. I mean, just this week we heard about, we saw the list, didn't we, Francis, about the ICU facilities in the country. I mean, I just wrote down a few of them. Isiolo, Elgeyo Marakwet,
is it 22 counties?
22 counties? Yeah, Limo, that have no ICU beds, no ICU facility, no ventilators. Imagine if all of these people go into hospital and are sick and in need of healthcare at one go. Considering, like you said, the hospitals are not empty, waiting for COVID-19 cases. Another thing that has struck me in this week was what the CS said, the age range of those who are infected so far, of the 110. He said the age between 16 and 64.
Exactly.
So we have a 16-year-old. And of course, that projection that we had from the DG Amoth, that we could have 10,000 cases by the end of April. Now, what I'm hearing from doctors is that many of these cases will go undiagnosed, unreported. Some people will have mild symptoms and are able to recover on their own in the homes. Other people will die, of COVID-related deaths that will not be reported as COVID-related because we will never know they didn't get diagnosed and they didn't get tested. These are just some of the interesting things, I think, and like you said, it is home now, these are people. One last thing that I found interesting. So we have 3 persons who are dead from COVID-19, and we also have 3 persons who are dead from alleged police brutality in the last 7 days of the curfew. I just find that really striking at this moment. Make of it whatever you will, but
yes, and we'll come to the curfew later on. I'm sure we'll have interesting conversations there. But Francis, what also strikes me is the fact that the last 2 days we've been reporting double-digit increases in the number of people who are infected, but these are from people who are quarantined. There is also the question of, what about those who are not quarantined? I mean, what is going on there? Because remember, before this, we were getting all these numbers, 7, 9, that sort of thing. And given the fact that those networks are now much bigger, if you think about the number of people they were tracing when they were talking about all these new cases, Kilifi, for example, every time there's a report, you hear someone from Kilifi, which means that thing had really spread. It seems to me that when we turn back now and say, okay, we are finished with the people in quarantine, now we are coming back to the rest of us out here, it might be what Mutahi Kagwe was calling the exponential growth in the number of cases.
Absolutely, and I take note of 2 things. Number one, in the last 48 hours, we've reported 51 cases out of 110 in 48 hours.
Half of the cases.
Half of the cases in 2 days. And so I dare say, as we move on in the coming days, the number will continue to increase. So 22 yesterday, 29 today. I won't be surprised tomorrow if it is 30-something or 40-something or 50-something. And this should send a very worrying statement to all of us that these infections are here with us. We're talking about community infections. If you're talking about only guys in quarantine, that's where we're getting the majority of the numbers. What about those people who interacted with the persons who came earlier? Have they recovered? Did they contract the virus? And the numbers, as we see them, will keep increasing. When Dr. Amoth talked about projections, 1,000 cases in the first week of April, 5,000 cases by mid-April, and 10,000 cases by the end of April, we may not necessarily maybe get there, but near there. And this sends a very bad message across the country. Why do I say so? There's a lot of concern about people who are moving from Nairobi up country. Why is there concern? Because they're taking the virus from Nairobi up country, where the health facilities up country are deplorable.
Even worse,
Yeah? And so you can imagine what will happen in those up country areas if there's a surge in infections. Yesterday, somebody was telling me of a case in Kikuyu, that there was a reported, I don't want to call it suspected case, but you can imagine there is no isolation center in Kikuyu sub-county, in Kiambu County. And they had to call the governor, call the minister, call the PS to come and evacuate that suspected patient to Nairobi. So are we communicating up, down, or down, up? That's where my challenge is.
Interesting about government reports. But Jamila, there's something I specifically wanted you to talk about.
Yes.
Looking at the trends worldwide, I mean, it's a mixed bag. Different countries have had different trajectories up to where they are now. But countries like Spain, like Italy, are particularly striking because within the first maybe even 3 weeks or more, I mean, Italy up to the 25th day, they were still reporting like 3 cases every day, 2 cases and that sort of thing. And that could lull you into this space where you're thinking, this thing is not that bad.
That's true, Joe.
One gets the feeling that's what we're dealing with here.
I think so, and it's really scary considering that in Spain, in the past 24 hours, over 950 people have died.
The highest ever
That's the
death
highest
recorded
ever.
in a single day.
In one day. Yeah. And as you said, and I think Yvonne spoke about it, that now it's not even just the old people dying. The youngest person to die from coronavirus is a 6-week-old baby who died in the US. We have a 13-year-old who died in the UK, and you have a 12-year-old who died in Belgium.
There's a 30-year-old
Uganda reported 11 of the last cases they reported actually were all children.
Well, all children. And of course, ours today, the cases that had been reported of those with the virus are between 16 and 64. So we need to actually start getting worried. As you've said, Joe, but there's that table that we're looking at, and it showed that I think up to day 20, I think Italy had like 3 cases. And suddenly you start seeing double digits, then triple digits, then you're in the thousands. In fact, I've said that up to now, about 1 million people have been infected. Yeah. And more than half of those million people come from 5 countries. That is USA and Italy, Spain, Germany, and China. And the numbers keep growing every day. Other than China, which is slowly somehow going back to normal in terms of infections, all these other countries are grappling with those increasing cases. And I think most of them are sitting back and thinking, I wish we had taken action earlier. I wish we had insisted on social distancing. I wish we had closed all our borders and our airspaces earlier. I wish we had asked people to wear masks more earlier. Then maybe we would not have seen this. And I think we need to get to that point where we need to do what we need to so that we don't get to a point where you have 950 people dying in a single day.
And I think I understand.
And Joe, my fear is days ahead we'll have more to wish for. We'll have a lot of regrets to look at and say, I wish we acted in February or even in the last 1 week. I know in this particular forum here last week, most of us in the gang here thought that a lockdown may not be a very good idea. And I don't know whether that position would remain the same right now, because there's only one way of dealing with this virus, and that is, first of all, cut off the transmission.
Yeah, there are people who are now saying, as you're saying, that we need to now start discussing what are those things we need to do when we have a lockdown in terms of making sure that people have supplies, their food, and that sort of thing. That the conversation,
and those are the things, Joe, we should have been trying with the curfew. What is the curfew achieving? I know we're going to discuss this later, but don't just do things, do some...
have measures.
Have measures, yes. What are they? What is that? What are those measures supposed to produce? Because the one sad thing is, forget about the government, forget about the advice from the ministry and health experts. The mwananchi, a lot of them have not changed a single thing about how they carry on with their daily lives. If you're talking of social distancing, we're talking of a massive failure of that concept to work, especially in urban areas, in slum areas. People are going on with life the normal way. This morning I was in Kibera and I saw people greeting each other just like they do on normal days. On normal days. if there is a transmission, if there is an infection there, then it will be transmitted
which is why I think we have a situation here, because there are people who say, well, you know, there are places in this country where people live very close to each other, the kind of businesses they do, the livelihoods and everything, and that is one level. But I think there's just another level where people are basically just not bothered about some of these things, because shaking someone's hand, there is no economic situation that compels you to shake my hand. I mean, that is just the truth. There are certain things that you can just do, but we are not doing it because, you know, kind of we think this is how we've always lived our lives and everything. But Yvonne, something struck me in the explainer that you did towards the end. Dr. Kalebi, I think his name is, he was talking about these things they call reagents.
Yes.
These things that are used in the testing to determine your status and all of that, that there's a shortage of those things. Those things come from countries out there like Germany that are themselves dealing with their own COVID-19 issues, that people need to recognize the fact that controlling this disease is going to be very difficult if we have large numbers, because we will need lots of supplies which we do not have, which we cannot make for ourselves. There are things like masks. Maybe you might say, oh yeah, you know, we can have some tailors do something. Yeah. But the truth of the matter is that there are things, when it comes to specialized treatment where people need ventilators and all of those things. Right now, countries like the US, they're struggling to get enough of those things. So if we get into a situation here where we can't get, we need those things, we can't get them, we can't make them for ourselves, and the people who usually make them really
are struggling with their own situation.
Struggling with their own situation. I mean, think about it. I visited, it's a private testing facility, so it's not government, but even they have had such issues with procurement. In fact, I think they're getting their first consignment, because what happens is, because we don't have the reagents, they collect samples and take them to South Africa for testing. But they will be getting their consignment next week. Now, a lot of the companies that are producing this, South Korea, Germany, and a lot of those are, you know, those companies, and the US as well. And what's happening is they're producing for themselves first. And the importance, who wouldn't, who wouldn't? And then whatever, you know, is left is what they would send to us. And Jamila has given us the numbers of what's happening in Europe. And then remember, he says, even though there's cargo that's being allowed in, there's strict protocols that are being followed. They must make sure that all of this cargo that you're sending is sanitized there, in transit, when it arrives, you know, at this point. And remember, testing is one of the most important tools in fighting the disease, because it enables you to know how many people you're able to map. So these are the areas where, you know, the disease is, and it's spreading fast in region X as opposed to region Y, what's going on there. And that's why we're seeing a spike now, because they're mass testing the 2,050 people who are in mandatory quarantine. But like you said, what happens out there? So even as people talk about, you know, let's do mass testing, at this point you have to be very judicious and, you know, making the decisions about who to test, who not to test.
It doesn't cost nothing.
It doesn't cost nothing to test. And even about that equipment that you're talking about, you know, the ICU facilities, we are going to make doctors make life or death decisions. Doctors are literally playing God. They decide who lives and who dies, because we don't have enough equipment to help everyone that would need it if we get to that stage. We have seen the same thing happening there. And
especially in Italy.
Especially in Italy. I mean, literally. And by the way, that situation was there even before COVID, all right? So, I mean, in places like Pumwani and others, you know, when there's oxygen and a mother has delivered and she's critical, doctors still do make those God decisions. Do I give oxygen to the mother or to the baby? You start to, who is stronger, who would survive, who has a higher chance of surviving, what do I do?
Horrible choice to have to make. And that is in
ordinary times. Now imagine, in this extraordinary moment, you know, this is a tough time. And this was the thing that struck me with what Dr. Kalebi said. He said, even if you had all the money in the world, right now, it will not help. So think about that.
So the best chance is to ensure that this thing doesn't spread any further than it has.
And it'll only be done by us.
And the closer we get to these statistics, the more worrying they become. Yeah. And you see, it makes more sense when you hear the CS and all government officials tell us, please take care of yourselves. Observe social distancing, hygiene and everything else, because there's an understanding that we will not be able to deal with the curative aspect of it would rather deal with the preventive aspect of it. It's easier, and it will cost us nothing to prevent, but it will cost us heavily to cure, because we don't even have those facilities. I mean, we were struggling with our health system even before COVID. I mean, how many people have gone to, let's say, rural hospitals and they could not get basics like medicine? They could not find enough medical personnel then before COVID. And now with this situation, look at countries that have well-established medical facilities and medical care. They are struggling. God forbid if we get there. It will be terrible for us all. And so maybe it makes a lot of sense to keep telling our people, to keep telling ourselves that let's take care of ourselves, let's observe these guidelines, the protocols that are being given, because we will not succeed if we get to that point. When you hear counties don't have enough medical personnel, when you hear they don't have enough equipment, then you wonder what will happen. And still, we have not suspended other ailments, the ailments that we were struggling with.
They're not on pause.
Diabetes, kidney issues, cancer, and so on and so forth. They are not on suspension. In any case, anyone who is suffering from those pre-existing conditions is more vulnerable with this COVID. So it makes it even worse.
That is true. Linus, I wanted us to talk a little bit about the communication thing, the communication aspects of this. We need to take a break right now. But when we come back, to just talk about how this is being communicated, because there are people I've heard who say, well, you know, there's a certain mystery around this whole thing, even in terms of the identity of the people, for example, even people who die. Because personally, I think if people saw the real face of someone, because I mean, like, obviously it has to do with family and all of that thing, but I think there's a sense in which perhaps if the government could involve families, have conversations and that sort of thing, because people die of all kinds of things in this country.
And it's not a secret.
And it's not a secret. And people will get to know anyway that there's a funeral there and all of this. So it might help to
taking a break. But people don't believe death. They don't believe recovery. I mean, we have people who recovered
all right.
and were released yesterday, and people are doubting that they... I mean, I think we'll have that conversation.
They need to give someone a break. We need a break right now. We'll be right back.